This is a blooming tea ball. We're going to be seeing this unfold. I have no idea what it is. So it's very similar to living with endometriosis. We get our best information from social media, believe it or not. And this is how you end up after decades, sometimes decades. For me, it was 30 years for a diagnosis. Some people, it's 7 to 10 years is the average for a diagnosis, and you're living in horrific pain. Many people experience painful periods. They experience painful ovulation. If you have the adenomyosis component to endometriosis, you are in pain pretty much all the time. And you have to hide it because people think you're crazy. Because unfortunately, our society still considers endometriosis a bad period, which it is not. There is a genetic component to it. They have found a gene, NSPR-1. It's a very rare genetic mutation, I believe. It's the same gene that also triggers asthma, which is interesting because many preteens who have endometriosis in their family, many preteens, I was one of them, get diagnosed as pre-asthmatic. So it is certainly time for people to understand this is not a bad period. This is a genetic thing. It runs in families, and if it runs in your family, you will have a higher chance of contracting this, of dealing with it, and probably with more severity than someone who is experiencing it for the first time in their family. So, I gotta show you this. We all know these were beautiful flowers once, vibrant, thriving, in a gorgeous place where they were living out their lives until they were harvested and dried, and that's what we ended up with. This is what endometriosis feels like when our society negates our existence, says it's not possible that this is happening. It's not possible that we're in so much pain, and even worse, that it is not possible to have endometriosis after menopause. That is the biggest pile of bull dust there is in the world. People with endometriosis can have this past hysterectomy into menopause. In fact, Dr. Tamer Sekin in New York City was one of the first surgeons to use a blue dye because he had a patient in her 70s that was coming in who had had all the surgeries that are supposed to be helpful. And he went in and he found that she was covered with clear lesions after using this dye. So please rethink how you talk to people with endometriosis. Rethink how you are dealing with them in your family. You're not doing yourself or them a favor. What can we do? Just as the blooming tea does better with hot water, so too do people with endometriosis thrive and live well and vibrantly when they're given the nourishment they need, when they're given the warmth they need, when they're given the care they deserve, when they are validated, when they are believed, when they come to a doctor who says, I believe you. What you are experiencing is valid. The change, the transformation is incredible.